Hello everyone, I hope everybody is doing well at home and safe. So we had completed the first introduction class of the cranial nerve, and we will continue in the second class the remaining portion of the introduction to the cranial nerves. So in the previous class I had told you about the number of cranial nerves, their names, as well as what type of nerve, what is the classification of the cranial nerves, as well as their site of origin. So we had said that when we are studying these cranial nerves, we will be studying the 12 pairs of cranial nerves. Each of the nerves we have to study under the following headings. So we discussed the first one, that was the type of nerve, so whether it is a sensory nerve, a motor nerve, or a mixed nerve. Then what is the superficial origin of the nerve, that is from which part of the brain will we look for the cranial nerve, where is it coming out. Then there was the deep origin, that is when we see the sections of the brainstem or other parts, where exactly within the brain the nucleus of the cranial nerves are located. So that is the deep origin. Fourth component which we will discuss today is the functional component. And deep origin also we will discuss along with it. Remaining portions are the course and the relation, the distribution, that means the branches, and lastly the applied importance. So regarding the course with relation, distribution and applied portion, the last three components, these three components we will discuss when we are discussing individual cranial nerves. So today we will discuss about the deep origin and the functional components. So first, before we go into the functional components, we need to know what do you mean by the functional components. So functional component means, so we had said that there are sensory nerve, there are motor nerves, okay. Now these sensory nerve are concerned with sensation, right. So this sensation can be of different type. It can be the general sense as in pain, temperature, touch. It can be special sense in the form of whether it is olfaction, that is smelling, or hearing, or balance, or vision. So these are the special senses. Then there are some visceral senses. Visceral senses also, there are special visceral sense and general visceral sense, as in special visceral sense means taste sensation, and general visceral sense means all the visceral reflexes that you've studied in physiology, like the Herring-Brewers reflex, the carotid body, the aortic body, and then the hunger, the nausea. These are all the visceral senses. So see, within the sensory part also there are different subdivisions. Same way in the motor part also there are some different components, as in we already said that there are some nerves, cranial nerves which are arising from the somites. Somites means, when we had said in the paraxial mesoderm there is a component of the myotomes. So from the myotomes, the nerves that are arising, they are carrying some type of motor fibers which are known as the somatic efferent fibers. Another one, we had told that when the head and neck development will be starting very soon, you will hear that the head and neck portion there are presence of 5 arches. These are called the branchial arches, okay. And each of these branchial arch are produced just by the side of the mouth over here, and each of these branchial arch has got different components developing from it. One of them being the muscles. So if there are muscles, the muscle needs to be supplied by a nerve. So each of these branchial arches are provided with nerves. So those nerves which are supplying the muscles developing from the branchial arches, they are known as the branchiomotor nerves, or the branchial efferent nerves. So these are the different components. We will describe in details about that in this class. So here we move on to the functional component. So we said there are grossly 2 types of functional component. So one is a sensory component, another is a motor component. Now a purely motor nerve will only contain any of these 3 motor component. Same way a purely sensory nerve will contain some sensory component, whether 1 or 2, but they will contain only sensory component. And a mixed nerve which has got both sensory as well as motor component, they contain a variety of combination of this sensory and motor. So it can be combination of any. So that we will get to know as and when we will study the cranial nerves. So motor component, you can see from this. Before we go into the motor component, one more thing is the another term for motor nerve is the efferent. Okay. So, we know there are two parts, afferent, efferent. This you have to get oriented to when you are doing neuroanatomy. So, efferent means they arise from the nucleus of the cell is within the central nervous system and the axons are coming out. Okay. So, how do you remember that? That means with respect to the central nervous system, efferent is from. So, in general, even in lymphatics also we have studied afferent, efferent. So, how you will remember? You have to remember efferent from and afferent to. That means efferent will arise from some particular structure and then go out. So, motor nerve, that is what it does. The cell bodies are located within the central nervous system and the nerve comes out, axon comes out. So, it is efferent from. Same way sensory, when we say, we can say they are the afferent. Sensory nerve, another name we can say afferent, but it will be afferent to. That means the cell bodies or the sensory components are in the different parts of the body and the sensation is carried to the central nervous system. So, it is going towards the central nervous system. So, it is afferent to. So, with this idea, so motor component is also called the efferent component and sensory component is also called the afferent component. Now, motor component, there are three subdivisions here you can see. One is the somatic efferent, another is the special visceral efferent or the branchial efferent, and the third is the general visceral efferent. Okay. So, these are the short forms we will use for them. You have to get acquainted. So, you have SE or you can say GSE also, general somatic efferent also. In general we mention SE only. Then there are the special visceral efferent, which we short form we call it SVE, or the same thing is also called the branchial efferent. So, BE also can be mentioned, and general visceral efferent is GVE. Now, let us see which are the nerves. I will just mention and then later on I will show you a picture. Somatic efferent, we already said, they are the motor nerves which are supplying the muscles which are developing from the somites. Okay. So, in the previous class I had briefly mentioned about this. So, they are which nerves? They are the third nerve, the fourth nerve and the sixth nerve. These three are supplying the extraocular muscle. Okay. So, they supply the extraocular muscles, and lastly you have the 12th nerve, which is the hypoglossal nerve, which supplies the tongue muscles. So, these four nerves, they are purely motor nerves, and the functional component, that means the fiber, type of fiber that they carry, that is the somatic efferent fiber. Okay. So, they are the third, fourth, sixth and the 12th nerve. So, third is oculomotor, fourth is trochlear, sixth is abducent, and these three, third, fourth, sixth, they supply the extraocular muscles which are helping in movement of your eyeball. And the 12th nerve, that is the hypoglossal nerve, it supplies the tongue muscle. Now come to the second component, which is the special visceral efferent or the branchial efferent. Okay. So, this special visceral efferent or branchial efferent, from the name only you can understand, they will supply the muscles which are developing from the branchial arches. Now, when the branchial arches are developing, there are total of 6 branchial arches which develop by the side of the head and neck. The 5th branchial arch, just after appearing, it disappears. So, basically there are 5 branchial arches, the 5th one disappears. Each of this arch is provided with a nerve. So, the first branchial arch is known as the mandibular arch. So, there is first arch, and the nerve of this arch is the mandibular nerve. Okay? And this mandibular nerve is one of the subdivisions of the 5th nerve, that is the trigeminal nerve. So, 5th nerve will carry special visceral efferent. Though it is a mixed nerve, one of the component will be special visceral efferent. Second arch is also called the facial arch, because from it develops the face along with the muscles of the face. So, the nerve will obviously be the facial nerve, which is the 7th nerve. Okay. Same way, third arch doesn't have a name, but it is supplied, the muscles on the third arch is supplied by the glossopharyngeal nerve, so that is the ninth. The fourth arch, the nerve is the superior laryngeal nerve, which is a branch of the vagus nerve. Okay? So, vagus nerve will carry special visceral efferent fibers. Fifth arch we said disappears, and we have the sixth arch whose nerve is the recurrent laryngeal nerve. Now, here there is a catch. This recurrent laryngeal nerve, which we will do when we will do vagus nerve, this recurrent laryngeal nerve is a branch of the vagus nerve. But the fiber that is passing through this recurrent laryngeal nerve, which basically supplies the muscles of the larynx, are not coming from the vagus nerve. It is coming from the 11th nerve, that is the spinal, that is the accessory nerve. Now, this accessory nerve has got two components. One is the cranial part, which is coming from the brain, and one is a spinal part, which is coming from the upper part of the spinal cord. So, here in this case, it would be the cranial part of the accessory nerve. Okay? So, right now you need not know beyond this, but special visceral efferent is carried by which cranial nerves? 5th, 7th, 9th, 10th and 11th through cranial root of accessory nerve through the branch of vagus nerve. Okay? So, anyway, 11th nerve, the cranial accessory part, is also having branchial efferent or special visceral efferent fibers. Now, coming to the third component, motor component, that is the GVE or the general visceral efferent. Now, this GVE or GVE or general visceral efferent, these are basically the parasympathetic fibers which are carrying mainly secretomotor fibers to the glands, different glands of the body. Okay? So, we know there are two systems in our body. So, autonomic nervous system, there are two parts in the body, that is, one is the sympathetic, another is the parasympathetic. Now, parasympathetic portion mainly comes from the, has got a portion coming from the cranial part, that is called the cranial flow, and another is in the sacral region, craniosacral outflow the parasympathetic system has. So, the cranial part of the parasympathetic system, they are mainly concerned with supply of the glands and some muscles to some extent. So, these fibers are basically carried by the cranial nerve through this component, that is the general visceral efferent, and they are mainly concerned with secretomotor fibers to the different glands of our body. So, which are the nerves that are having these GVE fibers? So, that means each of these nerves which will be having this GVE fibers, they will be concerned with a parasympathetic ganglion. Ganglion means connection of cell bodies. So, the cranial nerves that are concerned having these GVE fibers, number one is the third oculomotor nerve, then you have the 7th nerve, then you have the 9th nerve, and you have the 10th or the vagus nerve. So, that means I said 3, 7, 9, 10. So, the previous one was SV was 5, 7, 9, 10, 11. This is 3, 7, 9 and 10. So, that means when we are discussing these GVE fibers, we need to know which parasympathetic ganglion is this associated with. The third nerve, that is the oculomotor nerve, it is concerned with a ganglion which is known as the ciliary ganglion, which is present within the eye orbit, not the eye, in the orbit. The 7th or the facial nerve, this is concerned with two ganglions. Okay? One is the submandibular ganglion, okay, and another ganglion is the pterygopalatine ganglion. So, third is concerned with the ciliary ganglion, 7th is concerned with two more ganglions, one is the submandibular ganglion and another is the pterygopalatine ganglion. Okay. Ninth or the glossopharyngeal is connected with a ganglion which is called the otic ganglion. And the 10th or the vagus nerve, it is not concerned with any named parasympathetic ganglions, but here the ganglions are located in the walls of the abdominal organ. Okay? So, they are located in the walls of the abdominal organ. So, these are about the motor component. Now coming to the next part, that is the functional component, there are or the afferent fibers. Okay? Now these afferent fibers, there are mainly 4 types. One is the general sensory afferent or GSA, which is mainly concerned with pain, touch, temperature sensation, and this is mainly carried by which nerve? It is carried by the 5, the 7, the 9 and the 10 again. So 5, 7, 9 and 10. Next is general visceral afferent or GVA. These are mainly, I said, concerned with the visceral reflexes. Okay? So it is concerned with the visceral reflexes, hunger, nausea, herring brewer's reflex, carotid body, aortic body, and this is mainly 2 nerves will carry these fibers. One is the glossopharyngeal, that is the 9th nerve, and the vagus nerve, that is the 10th nerve. Next component is the special visceral afferent fibers. This is mainly the taste fibers. Okay? And 3 nerves carry it. One is the facial nerve, 7th, another is the glossopharyngeal, and another is the vagus nerve. Last component of the sensory is the special sensory afferent or the SSA. These are all the special senses. So they are mainly the 1, 2 and 8. So 1 is olfactory. So it is concerned with olfaction. 2 is optic. So it is concerned with vision. And 8 is vestibulocochlear. So it has got 2 components, the vestibular part and the cochlear part. The vestibular part is concerned with the balance of the body, while the cochlear part is concerned with the hearing. Okay? So these are the nerves and its functional components. So if you study this general introduction in a good manner, even if any cranial nerves come and you don't know, if you remember this, then you can at least write a few lines about each cranial nerves. Now, these functional components, which are either afferent or efferent, they all are having a deep origin, that is in the form of the nucleus, which is located within the central nervous system. So that we will correlate with the functional component. So this is the functional component of the cranial nerves with their nuclei. So if you can practice this diagram, the lower part of the diagram, not the A part also, it's not necessary, the B part if you recap, then it is possible for you to remember the functional component and the nucleus of any cranial nerve. So here in this picture I have just, there is a table here. In the first column you can see is brainstem, because the cranial nerve 1 and 2, they are coming from the prosencephalon, that is olfactory and optic, which is a total different entity. They are special sensory afferent, which will be described in a, they only contain only one functional component, that is special sensory afferent. They will be described totally separately. So this is what happens midbrain onwards. So midbrain, pons and medulla, all the cranial nerves that we talked about in the previous class, we will discuss about them. So here in the first column you can see the brainstem has been divided into, in this table, the midbrain, pons and medulla. Okay? And in the rest of the columns you can see with a imaginary line here where you studied this 4th ventricle, you had studied about the sulcus limitans. So on either side of the sulcus limitans, on the one side lies all the motor nucleus and one side lies all the sensory nucleus. So development part I am not going into the details. So in the left hand side of the sulcus limitans, here in this picture you can see they are all the motor functional components that we discussed till now, and on the right side you can see all the sensory components that we discussed till now. So you have in the motor component, first I am saying, you have the somatic efferent, you have the special visceral efferent, you have the general visceral efferent, the three components. Now, what did we say? If we start with the somatic efferent, we were in the first column in red, you can see the somatic efferent, the deep origin. So the nerves that have somatic efferent fibers, we said were 3rd, 4th, 6th and 12th. So from this picture, how will you know where the nucleus? So you can see 3, 4, 6, 12. Okay. So third nerve nucleus or oculomotor nerve nucleus is located where? See, it is located in the midbrain in the upper part. So we already know that it is located at the level of the superior colliculus. So when you have to write the oculomotor nerve deep origin, here you can, from this picture you can say that the motor nucleus of the oculomotor nerve, which carries somatic efferent fibers, are located in the upper part of midbrain at the level of superior colliculus. Lower part of midbrain at the level of the inferior colliculus, you have the trochlear nerve nucleus, 4. Further below if we go, lower part of pons, the 3rd, 4th, after that is 6th. The motor nucleus of the abducens nerve is located in the lower part of pons. Okay? And finally, in the medulla you can see an elongated nucleus here. This is the hypoglossal nucleus for the 12th nerve, which carries somatic efferent fibers. Okay? So from this hypoglossal nerve nucleus, the somatic efferent fibers of the 12th nerve come out. So this is about the functional component with the deep origin and the location of the somatic efferent functional component of the cranial nerves. Now coming to the second component, we said was the special visceral efferent or the branchial efferent. So we said there were 5 branchial arches, the 5th one disappears. Each of these arches have got one nerve. So we started with 5, 7, 9, 10, 11. So the 5th nerve, that is the trigeminal nerve, see the nucleus is located where? It is located in the upper pons, upper part of pons. So the principal motor nucleus of the trigeminal nerve is located in the upper part of pons. Lower part of pons corresponding to this abducent nerve nucleus, see you have the nucleus for the facial nerve, that is the motor nucleus of the 7th nerve. So it is located in the lower part of pons. Next you have 9, 10 and 11. So this 9, 10, 11, see they are coming out, the fibers are coming out from the same nucleus, and that nucleus is called the nucleus ambiguus. Okay? So this nucleus is located where? It is an elongated nucleus located along the medulla oblongata. From the upper part of nucleus, the 9th nerve comes out, from the middle the 10th, and from the lower part the cranial part of the accessory nerve fiber come out. So that is about the location and the nucleus of the special visceral efferent. Now come to the general visceral efferent. Now in the general visceral efferent, we said they were the secretomotor fibers which are concerned with the parasympathetic ganglions, right? So we said they were 3, 7, 9, 10. So 3 is oculomotor nerve. So see this nucleus is again located in the upper part of the midbrain along with this somatic efferent nucleus, and the name of this nucleus is called Edinger-Westphal nucleus. So this we will again discuss when we will do the oculomotor nerve. So this nucleus is called the Edinger-Westphal nucleus, and it is located in the upper part of the midbrain at the level of the superior colliculus. Next is 7, that is facial nerve. Now the facial nerve I said was connected to 2 ganglions. One was the submandibular, another was the pterygopalatine ganglion. Now this is the nucleus. So 7, and after that was the 9th nerve, and this is the 9th. So the upper 2 nucleus in the lower part of pons that you can see, they are for the 7th nerve, for the facial nerve, and that nucleus is called the superior salivatory nucleus. Okay, it's called the superior salivatory nucleus, and it is concerned with the 7th nerve, and in the lower part of pons, the same nucleus for the 9th nerve is called the inferior salivatory nucleus, and both are located, see, in the lower part of the pons. Lastly, 10th, again see 10th is an elongated nucleus, and that nucleus is called the dorsal nucleus of the vagus nerve, which is situated longitudinally along the medulla. Okay. So, this completes the motor component. So, let us see the position in the picture actually. So, see, this is actually that you saw was the cross section in the schematic diagram. This is actually the picture of the midbrain, pons and medulla. So, this is the midbrain, this portion is the pons and the lower part is the medulla. So, the red one that you can see just by the side of the sulcus limitans, this is the somatic efferent. Okay. So, you can see the oculomotor nerve nucleus in the level of the superior colliculus. You can see the trochlear nerve nucleus at the level of the inferior colliculus. You can see the abducent nerve nucleus at the lower part of the pons, and you can see this elongated nucleus, which is the hypoglossal nucleus, situated longitudinally along the medulla. Next, in violet you can see that is the special visceral efferent. So, you can see in the upper part of the pons, you can see the 5th nerve nucleus. Okay. In the lower part of pons, same at the level of this abducent nerve nucleus, this is you can see the motor nucleus of the 7th nerve, and longitudinal nucleus present within the medulla. This is the nucleus ambiguus, for you have this for 9, 10 as well as 11. Okay. So, this is SVE. Last motor component was GVE. In GVE, the nuclei were 3rd, 3, 7, 9, 10. Now, 3 is located here. It is not marked in blue here, but this is the nucleus for 3. You can see the name is Edinger-Westphal nucleus. So, it is located in the midbrain at the level of the superior colliculus. And lower part of pons, you can see 3 nucleus. The upper 2 nuclei is concerned with the 7th nerve. Okay. The lower of the upper 2, the lower larger one is called the superior salivatory nucleus, and the upper one is an extension of that same nucleus. It is called the lacrimatory nucleus. Okay. So, both are concerned with the 7th nerve, and in the lower pons below that, the other nucleus that you can see, that is the inferior salivatory nucleus, which is concerned with the 9th nerve. Finally, the elongated nucleus in the medulla that you can see, it is the dorsal nucleus of the vagus nerve. It is concerned with the 10th nerve. Okay. So, these are the motor component. Coming back to the sensory component, so just by the side of the sulcus limitans, you can see 2 components clubbed in together. One is the SVA, which is the taste sensations, and another is the GVA, which are the visceral reflexes. Okay. Both are coming from the same nuclei. So, SVA was 7, 9, 10 and GVA was 9 and 10. So, they are coming from the same nucleus. This is a nucleus of Tractus solitarius. The upper part of this nucleus is concerned with the SVA, that is taste sensation, while the lower part of the nucleus is concerned with GVA. Okay. Next is general sensory afferent, that is touch, pain, temperature, sensation. It was concerned with 5, 7, 9, 10. Now, 5 is located in the upper part of pons, which is known as the principal sensory nucleus of the trigeminal nerve. And from the lower end of this principal sensory nucleus, see a elongated nucleus is going down. This nucleus is known as the spinal nucleus. And this nucleus does not end in medulla here. It will go further down up to the upper 2 parts of the spinal cord also. Okay. So, this entire nucleus is carrying fibers for GSA, which is carrying touch, pain, temperature, sensation. So, 5th nerve is located in the upper part of pons, and the continuation of the same will be in the spinal nucleus will be 7, 9, 10. Okay. So, this is how. So, 7, 9, 10 is coming out is carrying sensation to the spinal nucleus of the trigeminal nerve, while the 5th nerve will carry the sensation to the sensory nucleus of the trigeminal nerve. Now, coming to the last part, that is the special sensory afferent, which is the special senses. That means Already vision and olfaction is not described here because they are coming from the prosencephalon. We are concerned with the 8th nerve here. So vestibular, vestibulocochlear. So see, they are lying where? Junction between the pons and the medulla. You have the vestibular nuclei here and you have the cochlear nuclei here. So here the last part I will show you in the second diagram. So here on the left hand side you can see the component. So the SVA and GVA we said were coming from the same nucleus. So that is the nucleus of Tractus solitarius lying within the medulla. The upper part was the SVA, the lower part is the GVA. So this elongated nucleus lying green color along the medulla oblongata, that is the nucleus Tractus solitarius. The upper part is concerned with the SVA while the lower part is the GVA. Now next you have the general sensory afferent. So upper pons, this rounded structure that you can see, I said that was concerned with the 5th nerve. So it is a principal or chief sensory nucleus of the trigeminal nerve. And see, from the lower end of that nucleus, another elongated nucleus is going straight down, crossing the medulla. It will extend into the spinal cord. This nucleus is known as the nucleus of the spinal or the spinal nucleus of the trigeminal nerve. This will be concerned with the 7th, the 9th and the 10th nerve. They will be carrying sensation from the 7th, 9th and 10th nerve. Now here in this you can see that from the upper end of this principal nucleus, one more nucleus is extending into, in the same line, it is extending into the midbrain. So this nucleus C is the mesencephalic nucleus of the trigeminal nerve. So in the previous diagram also you have seen, we have seen this. So here you can see above this 5th nerve sensory nuclei, this in the midbrain, this is the mesencephalic nucleus. Now what is this nucleus? Now this nucleus is, it is also a sensory nucleus. It is in continuation of the same sensory nucleus of the 5th nerve and the spinal nucleus, but it mainly carries proprioceptive impulses. So what do you mean by proprioceptive impulses? Like the position sense, the joint sense, the muscle sense, these senses are called proprioceptive impulses. So this mesencephalic nucleus is concerned with the proprioceptive impulses coming from your head and neck portion. So from your eye, from your tongue, from your facial muscles, they will all relate to this mesencephalic nucleus of the trigeminal nerve. Okay? And lastly here, lateral to that, you can see the vestibular nucleus in the pontomedullary junction. It is a pyramidal shaped nucleus here, and lateral to that you can see the cochlear nucleus. So you have the ventral and the dorsal cochlear nucleus, which are mainly concerned with SSA. So special sensory afferent. So with this idea, we will complete today's lecture. So how will this introduction help you is that if you can understand these two pictures well, if any cranial nerve comes, you can write. So like common cranial nerve that comes is the facial nerve, right? So facial nerve, if it comes and you are asked to write the functional component and the deep origin of the facial nerve and you don't know it. So if you remember this picture, then you can write that. So you can see that facial nerve in the motor component, it has got one motor component here. So that is the SVE, because we said it was the nerve of the second arch. And where is the deep origin? It is situated in the lower part of pons. From this picture you can see. Second motor component of facial nerve is the GVE. So which is located where? We said the superior salivatory nucleus and the lacrimatory nucleus, which are again located in the lower part of pons, which are connected with two ganglion. One is submandibular, another is the pterygopalatine ganglion. So these are the two motor components. So 7th nerve or the facial nerve, motor component it will have two. One is SVE, another is GVE, and we know the nuclei also. Now sensory component, what this has? So you can see here in SVA, in the upper part, there is presence of 7th nerve. So it will also have taste sensation, SVA, and the nucleus also we know, upper part of nucleus of tractus solitarius. GSA, see, upper part of spinal nucleus also, which is located in the lower pons, will carry fibers through the facial nerve. So, GSA it will also have. So, facial nerve, if you are asked to write the functional component, we know the motor component here too, and we know the sensory component. And if you are asked to write the deep origin also, from this picture we can write that the SB is located in the lower pons, it is the motor nucleus of the facial nerve. GV is also located in the lower pons and the name is the superior salivatory nucleus. SVA is also located here in the upper medulla, where in the upper part of the nucleus tractus solitarius. GSA is also located in the lower pons and the nucleus is the spinal nucleus of the fifth nerve. So, if you know this picture well, then it is possible for you to write the deep origin and the functional component of any cranial nerve, even if some other nerve curve which you have not studied. So, with this idea we will complete the general introduction of the cranial nerves, and in the subsequent lectures we will discuss about the cranial nerves, the important ones, mainly the ones that are very important for your theory. We will discuss those in the subsequent lectures. Thank you.